Limitations of repertory. Repertory is basically an index. Naturally, it can serve only a limited purpose. It can never replace a physician's mental application and knowledge of materia medica. Usually one blames and accuses the repertory when he fails in selecting the right remedy, even after repertorization. It should be always remembered that the repertory is like a tool and much success depends on the skills of the practitioner using it. If he does not use it properly, it can produce blunders and the achievement would be very limited. So, in order to use it effectively, one should be fully acquainted with all the aspects of the repertory, and one should also be aware of its limitations and adaptability. 1. It is a means to an end, never an end in itself. Repertory gives finally a small group of medicines with different grades, but seldom suggests a final choice. It is the duty of the physician to go back to the final court of appeal, the materia medica, and establish a correspondence. 2. Different repertories by different authors are based on their own philosophy and follow their own plan of construction. Thus, each one has its own scope and limitations. One should be thorough with all types of repertories in order to get the best out of them. 3. As Boger pointed, every repertory is useful, unfortunately not one is complete. Materia medica is ever enlarging. Every day there are new clinical experiences. New additions to materia medica cannot be accommodated in repertories on a day-to-day basis. Hence, they cannot always keep pace with the latest in materia medica. To that extent, this is a limitation. 4. There are many rubrics which are not represented well. Therefore, they cannot guide a physician properly in the selection of a simillimum. 5. Mechanical use of repertory, they relate symptoms and/or rubrics, which is an interpretation of the physician. If the physician makes a mistake at the beginning, by ignoring the person and just counting the symptoms and marks, then using a repertory will be futile. 6. The repertory cannot give guidance regarding the potency, doses, and repetition schedule. Therefore, a physician who handles the repertory must be thorough in all these and other aspects. 7. Nosodes are not represented properly in any repertory. However, modern repertories have included nosodes. 8. Handling and use of repertory cannot be independent of the knowledge in materia medica, organon, or clinical subjects, as well as knowledge of human behavior. Repertory is an instrument and its successful use depends upon the physician and his thorough knowledge. Generally, repertories are criticized by those possessing inadequate knowledge about it, because they cannot get the best out of it.